After you return home from surgery, you will need to follow the instructions for post-op care provided by the hospital and your surgeon. This helps make sure you recover well. The hospital will give you instructions on how to care for your incisions. Your surgeon may also give you restrictions, like no lifting over 5 to 10 pounds, no baths, no swimming, no solo or partnered sex, no vaginal suppositories, no tampons or menstrual cups, and no driving. It is important to rest after surgery. You may not feel much pain, especially if you're on painkillers, but doing too much could affect how well your body recovers on the inside. Remember that even though the incisions look small, a lot of surgical work has been done inside your body. Your surgeon will give you an estimate of how long your recovery might take, but recovery is different for everyone. Your pain levels after surgery may be unpredictable, higher on some days and better on other days. You may experience fatigue or even post-surgical depression. This is common, but if you have any concerns about symptoms you're feeling, either physically or mentally, contact your medical team for help. For many people who have recovered from surgery, their pain improves. But some people still experience pelvic pain, even after all of the endometriosis has been removed. This pain can be caused by other conditions that are common in people with endometriosis. Your surgeon might refer you to other healthcare providers, like pelvic floor physiotherapists, who can help treat and manage these conditions. Recovery is a journey, so please be gentle with yourself. The Endometriosis Network Canada is here to provide you with support and resources to navigate your endo journey. Remember, you are not alone, and support is available.